We know you care deeply about your patients and want to see them thrive. Yet, the challenges we face together in maternal health are significant. Missouri's maternal mortality rate is among the highest in the nation, with an average of 25.7 maternal deaths per 100,000 births. Even more alarming, 84% of these deaths are preventable. These are more than just numbers. They represent mothers, families, and communities impacted by gaps in care. At the Missouri PQC, our mission is Healthy Moms, Healthy Babies, Healthy Missouri. To support achieving this mission, we are proud to bring you the Ask Me 5 campaign. Together, we'll make an impact and succeed in realizing healthier outcomes for moms and babies across Missouri. Ask Me 5 is a series of questions designed to enhance patient interactions and improve maternal health outcomes. We know your time is limited, and this framework was created with your busy schedule in mind. Developed by the Missouri Perinatal Quality Collaborative with input from diverse stakeholders, this approach empowers us to build trust, address critical health concerns, and ultimately save lives. The Ask Me 5 campaign helps address these challenges by focusing on 5 critical areas identified in data as key to preventing maternal deaths: high blood pressure or preeclampsia, emotional and mental health, access to care, recognizing substance use, and trauma, abuse, and safety. To help you remember these 5 key areas, we've created an acronym, HEART, because at the very heart of the Ask Me 5 campaign are these 5 areas. The questions are short and direct, making it easy to integrate them into your existing workflow. Each patient and conversation is unique, so this flexible framework allows you to adapt your approach while fostering meaningful connections and addressing critical gaps in care. Our research has found how you introduce each question is just as important as the question itself. A warm, empathetic introduction sets the tone, signaling to patients that these conversations are meaningful, non-judgmental, and aimed at their well-being. Here are some strategies to create a safe and trusting environment that encourages openness and meaningful conversations. While these may seem obvious and trivial, they make a huge impact in the patient experience and foster building trusting relationships. Face the patient directly, rather than focusing on a computer or a clipboard. Make appropriate eye contact to convey attentiveness and respect. Keep your hands visible and relaxed to signal openness. Nod or mirror the patient's tone to show engagement. Maintain an open posture to avoid crossing your arms. Use reflective listening techniques to demonstrate understanding and interest. Begin visits by acknowledging the patient's effort to attend the appointment, such as, "Thank you for coming in today." These small but intentional actions can build trust, encourage openness, and ensure the patients feel valued and heard. Let's dive into the 5 key areas we'll be focusing on. First, we ask about high blood pressure. This is crucial because conditions like preeclampsia can escalate quickly if left undetected. Questions like, "Have you ever been told you have high blood pressure or preeclampsia?" Or, "Does your family have a history of heart disease?" help us identify risks early. Take the time to listen and document the patient's history carefully. It could make all the difference. A few examples are, "Understanding your history with high blood pressure helps me provide the best care." For instance, if you've been told that your blood pressure was high or you've been on a medication for it, I need to know so I can manage it effectively. Were either you or your partner born early due to high blood pressure? If there are any stressors in your life right now, sharing them can help us address any potential impacts on your blood pressure. Mental health is just as important as physical health, yet it's often overlooked. To normalize the conversation, I might ask, how have you been feeling? Or, do you have the support you need to care for yourself? These simple questions open the door for patients to share feelings of stress, anxiety, or depression. Remember, our goal is to create a safe, non-judgmental space where patients feel comfortable being honest. A few examples are, I want you to feel free to share whatever you're feeling, whether it's good, bad, or anything in between. Life can be tough, and I'm here to listen and to help. For example, if you've been feeling unusually sad, stressed, anxious, or are struggling with sleep, these are things we can work on together. It's also important to know if you feel supported at home. Your emotional well-being is crucial for both you and your baby. Community is important. How often do you see or talk to people that you care about and feel close to, whether it's family, visiting friends, etc.? Access to care is a significant barrier for many patients. Asking, are there challenges like transportation, childcare, or cost that make it difficult to attend appointments? Lets patients know we care about their ability to receive consistent care. If obstacles exist, we can connect them with resources to address these issues, ensuring they stay engaged in their health journey. A few examples are, if you ever have trouble making it to your appointments, please let me know. There might be resources we can connect you with to make it easier. For instance, if transportation or childcare is an issue, sharing this with me can help us find solutions together. Your health is important, and I want to help you in any way I can to make sure you can get the care that you need. Substance use can be a sensitive topic, but it's one we must approach with empathy and understanding. I frame the conversation by saying, I ask all my patients about substance use because it's a medical issue, like any condition that we treat. Then I might ask, can we talk about your experience with alcohol or drug use? Using non-judgmental language helps patients feel supported and not stigmatized. A few examples are, please know that my intention is to help you and put you and your baby in the best position to remain together. Sharing any substance use helps us create a plan to ensure you and your baby are healthy. If you've used any substances, telling me about it allows us to provide the right support and resources early on. We can connect you with recovery programs and support services, so being honest with me will help us help you better. Finally, we address trauma and safety. Creating a safe space for these conversations is critical. I might say, it's important for me to know if you feel safe at home, both emotionally and physically. If a patient discloses trauma or abuse, we should have resources ready to provide immediate support and guidance. A few examples are, feeling safe at home is vital. If there's anything making you feel unsafe, or if you've experienced trauma, please let me know. If you're afraid of someone at home, or feel you can't come to appointments freely, it's something we need to address together. In the past year, have you been afraid of your partner or ex-partner? Safety can mean different things for different people, so feel free to share anything that might be affecting you. Concluding the conversation with care is just as important as starting it. Thank your patients for their openness, outline next steps, and offer follow-up support such as resources or referrals. For example, you might say, thank you for sharing with me today. Let's work together to address these areas and ensure you and your baby stay healthy. By integrating the Ask Me 5 framework into your daily practice, we not only improve maternal health outcomes, but also strengthen the trust and connection we share with our patients. Together, we can make a profound difference in the lives of mothers, babies, and families across Missouri. Thank you for your dedication to providing compassionate, high-quality care.